Welcome, everyone. I'm excited to have you all here today to learn. This is another Health Talk with Larianne. If you're watching this and you like it, I will encourage you to like, share, comment, and follow so others can be able to see it. Today, we are bringing another episode of health awareness, and our topic of choice today is breast cancer. What is breast cancer? Breast cancer happens when cells in our breast grow out of proportion. As we all know, our cells go through a process of regeneration, okay? So our cells grow. For example, if you hurt yourself, you see new cells grow back. But if there is an overgrowth, then that becomes a problem. In the case of breast cancer, it's the breast cells, okay? So this affects both men and women. But though, obviously, it affects women more than men because women have more breast issues and women have more estrogen, the, the main causative factor in breast cancer. Okay? So we're bringing this awareness because, as always said on this channel, early detection saves lives. Okay, so what are some causes of breast cancer? Let's dive deeper into it. According to research, there is no single cause of breast cancer, but certain factors increase the chance of developing breast cancer. And we want to talk about some of those factors. What are some of those factors? Number one is gene mutations. Okay, genes such as the BRCA1 and BRCA2 or BRCA1, BRCA2, if there's mutation in those genes, it increases your chance of having breast cancer. Another one is long-term exposure to estrogen, as seen in early onset of your menses or late menopause. So early onset, that means you're starting to be exposed to estrogen sooner, and late menopause is you continuous exposure to estrogen, prolonged exposure to estrogen. This increases your chance of getting this disease. Family history of breast cancer, aging as relates to the estrogen exposure as well, lifestyle factors such as smoking and alcohol use. As we know, smoking and alcohol use damage our cells and prohibit them from developing the way they are supposed to develop. And lack of physical activity. The opposite, which is more physical activity, promotes healthy cell growth. But the lack of it will do quite opposite, which will promote unhealthy cell growth, such as cancer. Okay, so risk factors: you may be at a higher risk of developing cancer if you are 40 years and older. Because why? You've been exposed to higher estrogen, to prolonged estrogen. Okay, if you have a mother, sister, or close relative that had breast cancer before, you have higher chances of getting that. Okay, we talked about that BRCA gene and stuff, and then also if you've never had children or if you've had your first child after age 30, that increases your chance of getting breast cancer. If you are overweight or obese, especially after menopause, that's another risk factor. Okay. We talked about drinking alcohol regularly. We talked about smoking. And another one is if you've had breast cancer before. Some people get breast cancer, they get treated, they go into remission, and then that cancer comes back. So having that disease before just makes you at high risk because like your cells already have the memory of the disease there. There's a possibility that everything did not clear, or even if everything cleared, that mutation might occur again because you are more prone to it. It's just a lot of factors if you've had the disease before. So that's something to be aware of. An important note here though, having risk factors does not mean that you get the disease. It does not mean that you will get breast cancer. It just means that you should be at high alert that you have high chances of getting them. In fact, many people diagnosed of breast cancer have no known risk factors at all. So it's not something to make you afraid and say, oh, because my mom has this, so I'm definitely going to get this. In fact, some people will get tested for the BRCA1 and 2 genes, and they may decide that, you know what, I don't even want to worry about this, so I'm going to get on my mammectomy, take out the breast, and yes, that might work. You might not get it, and still some people take up their breast and they still get the disease. So it's about the choice that you and your healthcare provider are going to make. Okay, so let us talk about some signs and symptoms of breast cancer. A new lump in the breast or your underarm might indicate breast cancer. Breast pain that does not go away. And just so you know, breast pain is kind of like a late sign of breast cancer. So if you're experiencing that, that's a sign that you've had that a long time. So please pay attention to other symptoms, not just to breast pain alone. Okay, changes in your breast size or shape, like skin dimpling or thickening of the breast. And when I say thickening, like we've all eaten oranges before. So if you look at the peeling of the orange, just how it looks with the dimpling and the hole in it, if your breast looks like that, that might indicate breast cancer. So redness, warmth, or swelling of the breast might indicate breast cancer. Nipple discharge, especially discharge such as blood, might indicate breast cancer. Nipple turning inward, inverted nipple, sore or scaly stain on the nipple or breast. Those are all signs and symptoms of breast cancer. So it is important, essential for us to be aware of those signs and symptoms so that when we see them, when we notice them, we can alert our healthcare providers to stay ahead of them. Another point I wanted to stress is breast cancer is one of those cancers that have had a really high success rate of prevention, or even like being caught in the early stage to get treatment because of all of the research that have been done on the signs and symptoms. So another thing here, I want to teach you on how to do a breast self-exam at home. This is a technique that is going to save your life. That's going to save a lot of people's life. Okay, so if you haven't learned about this before, I urge you to pay attention. So you're doing this manually, you're doing it yourself. It's a self-exam that helps you to know what is normal for your body. Because in order to know what is not normal, you have to know what is normal for you. Okay, so what are you going to do and when should you do it? So it is recommended by research that you should do it once a month, regularly, once a month. And for women who are in the stage, or those that are still having their menses, let's say that way, should do their checks 5 to 7 days after your period, because we talked about that estrogen, right? During your period, your estrogen is high, and all of that may cause a lot of changes that might resemble the signs and symptoms that we listed up previously. So that's why it's advisable to wait 5 to 7 days after your period before doing that exam. And for our menopausal women, those are in menopause, you just select a day. It might be a Monday, Tuesday, Wednesday, Friday. Remember that day once per month and do it the same day every month for consistency. Okay, so how are you going to do this? Let's do this. You have a mirror, get a mirror, look into the mirror, stand with your arms at your sides straight, and then raise your arms up straight. And then first, you're going to inspect. You're looking for changes, okay? You're looking at your breast for those signs and symptoms that we listed up. But most importantly, we're looking to see how our own breast looks like, how our normal breast looks like. So you're looking for the size of your breast. You want to look at the shape of your breast, especially the nipples. Pay more attention to the nipples and the skin, okay? Is your nipple naturally inverted? Some people have inverted nipples. If that's it, note that. Look at the skin. Is it saggy? Is it soggy? Do you have that thickening? You want to watch out for those things. And then the next one is we are going to feel, okay? So feel your breast. While laying down straight, you want to take your hand, use the tips of your finger or the pads of your fingers, okay? You want to go down, move in a circular motion, and you want to cover the entire breast. You want to cover the entire breast and the underarm as well, because that's where we have our lymph nodes, okay? And those lymph nodes are prone to contracting cancer as well. So we want to do that in circular motion under our entire breast, our underarm. You can go lightly, you can go midway or medium, and you can also go deep. Deep pressure might give you the best result because you'll be able to feel deep tissues, okay? And for most women or some women, we have natural thick breast tissue, dense breast tissue. So that can alert your provider to send you for other exams such as like the MRI, just to make sure that it's just your natural thick breast, is not anything concerning for cancer. So so that's how we do that self-exam. Excuse me. So it is recommended to do regular screening. And some screening options include what? Mammogram. Mammogram is just like taking an x-ray of your breast. You go into the machine, kind of put you in there and squeeze you up, take a picture of that breast and the breast tissue. That's the first, that's the test to do, we call mammogram. And then another one is just the same exam that we did at home, but being done by a professional. They know what to look for. You are testing for your healthy breast tissue to see, to know if there are any changes, but your provider is going to check for abnormalities, okay? They're going to check for anything concerning there. And as I said earlier, like for our high risk patients that have those risk factors that we discussed earlier, like the BRCA gene and family history and all of that. And then in addition to thick breast tissue, dense breast tissue, they might send you for an MRI just to be on the clear, okay? So why does it matter? It matters because it will help us detect cancer early. And if we detect cancer early, treatment is more effective. When treatment is more effective, it reduces death from breast cancer, and it also gives peace of mind to us and our family members. That's why many guidelines recommend that regular mammograms should start at age 40 because of prolonged exposure to estrogen at that age, okay? And it could start earlier if you have high risk factors that we've discussed before. Early detection saves lives. Know your breasts. Get checked monthly. And speak with your healthcare provider if you have any concerns. I know this is a any concern. I know this is a rather touchy topic. Many people shy away from it. Many people are afraid of the unknown, or rather afraid of knowing what is or what could be. I urge you, do not be afraid, because you would be in luck if you are detected early than not wanting to know and being afraid and be detected lately, when the chances of you going to remission or getting cured is less than getting detected early. Okay? If you like what this video says, if you like the information, share, like, and follow for more health tips. Once again, my name is Larianne, and I appreciate you all for watching. Thank you. Bye.